Next, we will hear from Dr. Anuradha Rao-Patel, MD. Dr. Rao-Patel is the AVP and Senior Medical Director at Blue Cross and Blue Shield of North Carolina. She is responsible for the evaluation of medical necessity, appropriateness, and efficiency of the use of healthcare services, procedures, and facilities under the provisions of the health plan. Before joining Blue Cross NC, she worked in a private practice doing acute care and chronic pain management. She is also an advocate for protecting the mental health and well-being of children. Dr. Rao-Patel will discuss Blue Cross Blue Shield's innovative strategies for approaching mental health through the community. Dr. Rao-Patel?
Thank you. Thank you for the warm and kind introduction. I appreciate it. And hello, everyone. Thank you for taking the time today to join this important webinar. And thank you to the NIHCM for having me today. And anecdotally, I was recently, if you go to the first slide, that would be great. I was recently talking to my child's principal, who recently retired from her role, and we were talking about just some of these poignant issues that our two speakers were talking about, the struggles of children and youth today related to food insecurity, loss, mental health struggles. And I know personally as a physician, you can't just look at somebody or really even understand just by looking at them entirely what's going on in that person's life, especially when we think about children. Oftentimes they don't come out and say, you know, my dad drinks a lot, or I don't have enough to eat, or I feel less adequate. And so it's important that we continue to have these conversations and talk about this and continue to destigmatize mental health. And that's how we do it, is by talking about it and by bringing education and awareness to it. So if you can go to the next slide. So as I mentioned, this topic is so timely, not because the well-being of our children's mental and frankly physical health is a new one. It's because there's such an urgency about it right now. One news story after another has made it clear that our children are facing a monumental crisis when it comes to their mental health. Earlier this year, the CDC released a heartbreaking report which showed that feelings of hopelessness and despair were increasing among all of our adolescents. And really more than half, nearly 3 in 5 adolescent girls felt persistently hopeless or sad. And while all teens reported increasing mental health challenges, experiences of violence and suicidal thoughts and behaviors, we heard a lot about this as well, that girls actually fared worse than boys on all measures. Next slide, please. So in my state in North Carolina, there's a North Carolina Child Health Report card, and it tracks key indicators of children's health and well-being in 4 areas. It's healthy births, access to care, secure homes and neighborhoods, and health risk factors. And this report provides data on drivers of health, such as access to healthcare, graduation rates from school, risk factors such as asthma, teen births, infant mortality, poverty, child deaths. And more than 1 in 5 high school students have seriously considered suicide. We heard about suicide rates going up from my colleagues who spoke before me in 2021, up 16% from 2017. And the diagnosis of mental health concerns are also on the rise. More than 1 in 10 children ages 3 to 17 in North Carolina had a diagnosis of depression or anxiety in 2020, which was almost a 50% increase from 2016. But the good news, if there is any good news about those stats, is that we are talking about this more openly as a nation. We're talking about youth mental health, and as I mentioned earlier, we need to continue to keep open dialogue. One of the challenges, I would say, is that there's no one-size-fits-all approach to addressing these needs. And in fact, we can't talk about a child's mental health and well-being without talking about the child's caregiver's well-being and mental health. Young people don't just face individual social and economic and academic challenges that we've all dealt with, right, when we were young, but they also take on the traumas of their parents and caregivers. And for the past 3 years, as we've gone through COVID, those traumas have been especially significant. So really addressing mental health challenges in children requires a whole person, whole family, whole community approach, and I'll talk about that shortly. If we can move on to the next slide. And if we could just hang on to this slide for just a bit, when we talk about stressors, and we've heard stressors mentioned several times, Young people were already experiencing significant behavioral health challenges before the pandemic disrupted our lives on so many levels. And you take social pressures, the usual social pressures that we've all dealt with, and you disrupt social networks, and then you completely twist the system and make it even worse. So children have also been dealing with profound levels of grief and loss. In fact, more than 250 children in the United States have lost their primary caregiver as a direct result of COVID. They've also lost peers, their teachers, faith leaders, neighbors, other loved ones. And that's nothing to say of the children who've had their family torn apart because of factors indirectly related to the pandemic. We talked about and we heard about the rise of substance use disorders. 40% of the children in the foster care system are there because of parents' misuse of drugs or alcohol. And the pandemic also introduced things like unemployment, financial insecurity in households, which also increased the risk that the child will face abuse, neglect, or absorb the parental stress in other ways. And when we talk about health impacts and the long-term impacts of those things, grief, parental separation, substance use that I talked about, physical abuse, neglect, those are just a few examples of what's listed here with adverse childhood experiences. And those effects we know can last a lifetime. According to the CDC, in fact, nearly 3 of 4 high school students reported one ACE or adverse childhood experience, and 1 in 13 experienced 4 or more ACEs during the COVID-19 pandemic. Students who face trauma often find it more difficult to engage with their schoolwork. ACEs are linked with anxiety, depression, disruptive behavior. These challenges with cognitive impairment and self-esteem can continue on into adulthood, and that undermines family structures, employment, health, and well-being. And once a child has accumulated 6 of these ACEs, they stand to lose 20 years of their life expectancy on average. And on top of these universal challenges, some communities face unique pressures. We just heard about that. Young people of color, LGBTQ+ teens, rural communities. Next slide, please. One of the significant challenges we feel here in North Carolina, and again, it's not unique to our state, we heard this with our first speaker, is the lack of qualified health professionals. This is the map of the health professional shortage areas, or the HPSA, which is put together yearly and refreshed by North Carolina DHHS. North Carolina has 100 counties, 78 of them are designated rural counties, 91 of them are designated health professional shortage areas across 3 major areas of healthcare: primary care, dental, and medical and mental health. So we have to keep sight of the fact that this isn't just an issue that affects physical health. A few realize and recognize the severity of our access to mental health here in North Carolina. The pandemic has driven greater demand for mental health care, but many North Carolinians didn't know where to turn for help. But it's important to understand that building a more robust workforce to handle our state's growing need for health and clinical care is only part of the problem. People face barriers long before they try to book an appointment or even walk through the door of a provider's office. Next slide, please. And really, to summarize what I was just talking about, mental health problems are not adult problems. Depression, anxiety, and other mental health challenges can show themselves as early as age 3. Unfortunately, treatment for most of these doesn't begin well into adulthood, usually 6 to 23 years after symptoms first appear. Unmet mental needs will impact a lifetime, putting children at greater risk of academic and social challenges, likely escalating into more serious mental illnesses. In fact, roughly half of all adult serious psychiatric disorders first appear during childhood or adolescence. And so really, when we think about this, no child's future should be written in stone or is written in stone, but strategic direction now will help ensure that more children's needs are addressed and that they stay on course for a healthy and rewarding life ahead. And as the speaker mentioned, I work at Blue Cross, and we have a specific way that we're trying to address this, and understanding that action must unfold on multiple fronts. So if we can go to the next slide on the whole person approach, we really need to understand and stop thinking in terms of mental health versus physical health. There's just health. So both of them are intertwined and inseparable. Some of the things that we've done, we have prioritized access to primary care and mental health care providers through telehealth. We've collaborated with a company called Headway, which is to expand our network of behavioral health providers with a specific focus on improving access to care for children and adolescents, especially in these rural and socially vulnerable counties. One of the more critical components of this effort is how we're integrating mental health and substance use treatment into primary care, because we know there are not enough mental health and substance use providers to meet the demand. So we've made it a priority to invest in ways to reward primary care providers who are attuned and ready to respond to their patients' mental health needs. And this can really, as I mentioned, identify potential risks before they escalate into crisis. We also have internally a dedicated team of care navigators, and they match members experiencing mental health needs with providers who can provide that ongoing support. On our next slide, when we talk about the whole family approach, as I mentioned, supporting a child's mental health needs means supporting the caregiver and the family more broadly. And we try to meet members where they are on that continuum of healthcare needs. So we've done a lot to address and fight the nation's opioid epidemic. We heard some of the stats around that by participating on the President's Commission, testimony to the Senate. We've invested in prevention and treatment that benefits everyone, not just families who are involved directly with substance use disorders. And we really need to look at a holistic approach and system of care that emphasizes positive outcomes in the form of family continuity and security, because that's what brings and builds the stronger communities. So Healthy Blue is Blue Cross's Medicaid program. We've done such a thing to launch an evidence-based model of family-centered treatment, and that will provide long-term stabilization with families with youth who move between child welfare and juvenile justice systems, and they could be at risk, obviously, of unfavorable and traumatic situations such as being removed from the home. An example of some exciting work at a national level that's being done to promote healthy childhood development by integrating family well-being into the pediatric care setting is Reach Out and Read, and that's a national program, and that provides it gives providers books, they're called prescribed books, to help caregivers who have limited resources and access to reading materials to share with their children. Next slide. And when we think about a whole community approach, it's important to think on two levels. So we have to think what can be done to support the community's capacity to respond to this mental health crisis, and two, how do we leverage local opportunities and the boots on ground expertise to have a broader impact. So for example, at my company, we committed $2 million to support 11 community-based organizations to expand pathways to mental health in rural and underserved areas. There's also a better need and a stronger need to equip healthcare professionals, social service providers, educators, and community-based organizations to develop and deliver trauma-informed care. We need to support children in foster care and their families. We want to support children that are very high risk of entering the foster care system or going into a group home. And the goal is to really change that family's trajectory with intensive support, new parenting and communication skills, and evidence and strengths-based mental health intervention services. And finally, outdoor exercise. It's definitely worth emphasizing the importance of investing safe spaces for children to play outdoors. Green spaces and play spaces are not equally distributed. In many cities and towns, families living in affluent areas have greater access to parks and greenways and community gardens. These areas are scarce in many rural areas and historically underserved communities. Sidewalks, parking lots do not offer the same opportunities for safe and imaginative play. So when we think about the health benefits of outdoor activities, physical fitness probably comes first to mind, but data clearly shows that it also yields psychological benefits and things that we don't just get from going to a gym. Last slide, please. So finally, I'll just add that working in silos will not solve the challenges that our children face. It will not harness local resources that each community can bring to the table. As a local company, Blue Cross actually has roots in the states that we serve. We are based in North Carolina. We have service in all 100 counties, and our presence has essentially remained steadfast since 1933. But we learned that there's a lot more to learn and to explore. And every day we solidify our connection to the state by listening and acting on what we hear. And this is what is displayed here is this Extra Miles tour, where our leaders have gone and are going to all 100 counties across the state to understand what are the struggles of the counties, who are the boots on ground people doing the work, how can we leverage what we learn in one part of the state and utilize it in another part of the state. So we're discovering the possibilities and brainstorming new strategies to really improve the health of rural underserved communities. And that's really the essence of the work that's ahead, right? It's turning the tide on youth mental health, and that demands listening and sharing and collaborating, and with our children, our families, across our communities. So I appreciate your time today, and thank you very much.
Thank you so much, Dr. Rao-Patel, for sharing Blue Cross's strategy and for that holistic and compassionate approach to child mental health.